Heart disease is the leading cause of death in this country, and the experts at Mercy Gilbert Medical Center are dedicated to looking for the best treatments for this disease. And joining me now are Dr. Nabil Deeb, who is the Director of Cardiovascular Research, and Dr. Jonathan Hodgson, Stroke Center Medical Director. It's good to see you both. And this is a very important, we're talking about adult stem cell research and where we've gone with this. And you've had some amazing results. We're going to start with you. Talk about what you've seen in this research.
We started the stem cell transplantation for patients with heart disease about 12 years ago. Okay. And we did one of the first here in Arizona. And at that time, we used to isolate the stem cell from the skeletal muscle and then transplant them to the heart with open chest. A tremendous improvement has occurred over the last 12 years. Number one, related to the stem cell itself as a product, and number two, as a method of delivery.
Okay, so let's take a look at that video that you sent. This is an animation, and you show it's the same heart, kind of a before and after, and the dark spot is where it was diseased on the left?
Yes, here what you see on this animation is the heart. We have ability now to image the heart in a 3-dimension, as you see, and we can identify the area of heart attack. The red zone you see right here is the area of heart attack, and the dark spot is the area of stem cell transplantation. And what you see after 6 months, the area of heart attack has gone, and the new tissue has formed in the heart and replaced the scar tissue.
I see. So now you're taking the same technology, and now we want to go ahead and apply it to people who suffer from stroke.
That's correct.
Is it going to be something similar?
That's correct. So when we think of stroke, there's a blockage of blood flow to the brain for some reason. Now, once that occurs, the tissue is injured. Now, some of that tissue can recover, but some of the tissue dies. And when that's the case, the patient can have persistent symptoms. For instance, if a patient has a stroke, they can have significant weakness or numbness on one side of their body, where they can't use their arm, or they can have impaired speech. And those symptoms can be continuous for a long period of time and forever. Now, when we think of stroke, stroke is a huge burden on society because it's the #1 cause for disability in the United States right now, and a significant burden on the healthcare system as well as the patient and the patient caregivers. And so we want to see if this same principle that's applied to a muscle tissue, the heart, can be applied to nerve cells in the brain itself.
Now, Dr. Deeb, we're talking about adult stem cells. You have a picture of how that is delivered?
Yeah. Okay. Well, it's a few milestones has occurred, and major milestones. In the beginning, we used to take the cell from the same patients, whether the muscle or the bone marrow, and transplant it to the same patient. We call it autologous stem cell transplantation. Okay. But now, from one donor of bone marrow-derived samples, one can treat up to 10,000 patients.
From one?
From one donor. And those cells now, you can ship them worldwide, and they are available in the cath labs where you can transplant them. You can take them from the freezer, and within 5-7 minutes they are ready for transplantation.
Yeah, I think you have a picture of something like that, right, with the machine?
Yes, that's correct. This is a product. And so that was a major milestone and major development in stem cell therapy. The same cell can be used for a stroke victim. You can imagine the area of heart attack is an inflammatory process, and the area of stroke is inflammation or inflammatory process. So you can take those cells and transplant them with our patient to a victim with heart attack or a patient with stroke.
This is amazing. And what is happening now? Are people eligible to do this clinical trial?
So at Mercy Gilbert, we're looking at patients who have had a history of stroke in the past and have significant symptoms of significant weakness or impaired speech, and at this point have no other treatments available to them. We're going to look to see if are these adult stem cells safe for these patients, first of all, and also do they get any potential, is there any significant change in their symptoms over time after they receive the adult stem cells?
So is this getting ready to start now then?
That's correct.
So if someone is watching, can they still partake in the trial?
They can. We're actively enrolling at this time.
Actively enrolling. Very interesting. It's really amazing what you've done and how far we've come with this.
And it's very important for the audience to know in general about stem cell therapy now. Phase 1 and 2 completed for patients with heart attack and heart failure. And currently now we are undergoing a phase 3 clinical trial, which is a phase before commercialization. If the phase 3 is positive, you can imagine a wholly new way to treat cardiovascular disease.
Amazing. Thank you so much for joining us. Very amazing topics there. And if you want more information, I'm sure people are watching, they want more information about these trials that are going on. The best way to get more information is to go to Mercy Gilbert Medical Center, and their website is mercygilbert.org/research, and there is the phone number you see right there on your screen.